Governor Perdue is working on balancing the state budget. One of the areas he's looking at carefully is the university system of Georgia. Another area is health care and hospitals in Georgia, more specifically those hospitals with patients on Medicaid and the reimbursements they receive for that program. I'm Rachel Garrett for GBC News, and I spent some time today with Gwinnett Medical Center to see where it stood on the issue. Governor Perdue presented two options to hospitals and healthcare providers to help fill the gaping hole in the state budget. One option is to cut the reimbursement rates hospitals receive when they treat Medicaid patients. Mark Mullen from Gwinnett Medical Center says that a cut in the already low rates would slow the hospital's growth.
In terms of programs and services, I don't know if we're going to see anything immediately, but it definitely would impact what we do in terms of future growth. So new facilities, much like the lobby we're standing in right now, we'd have to hold back, maybe put things off a few more years, replacing large equipment or MRIs or things of that nature. We would just have to put things out into a longer term future. We just wouldn't be able to do as many things for the community as we have in the past.
The second option was first presented at the beginning of the legislative session and calls for all hospitals to pay a provider fee that, if high enough, would raise the reimbursement rate hospitals have for Medicaid patients. Mullen is concerned about this option too.
Well, we have concerns. There have been so many different options that they've discussed, everything from elimination of our exemption from sales tax to reductions in reimbursement, potentially provider taxes, that we just have a concern that some of these that we've looked at it could be $8 and $10 million impacts. So as we look at it, it sounds like for this round of the budget session, it may be that healthcare takes a significant impact.
One option that Mullen and other hospitals are interested in is a tax on tobacco products.
It generates a significant amount of revenue, revenue that can be then used to match for additional federal dollars for Medicaid. It's the best approach. It also then potentially will reduce folks from smoking. We look at the number of people that smoke here in the state, and it's significant. And when we looked at the numbers of the cost of that for Medicaid treatments, it's in the hundreds of millions of dollars. So from a best case scenario, it's something that drives an additional revenue and also reduces the cost for Medicaid as well.
Burt Brantley from Governor Perdue's office said over the phone that the provider fee needs to be about 1.6% of each hospital's net patient revenue. This, of course, will be different for each hospital, which means that some hospitals will be paying more of a provider fee and possibly getting less of a reimbursement rate back, depending on how many Medicaid patients they treat. However, he did say that many hospitals are coming around and the provider fee details are being worked out right now. They're trying very hard to not cut the reimbursement rate as it is now. For GBC News, I'm Rachel Garrett.